my name is Gagana Amanini, and I will be participating in the 2022 HOSA Clinical Specialty Competition. The career I chose was a general internist, and the skill that I'll be performing today is a basic eye exam. General internists use eye exams in order to diagnose systemic or internal diseases that would otherwise go unnoticed. First, wash or sanitize your hands with soap and water or medical grade hand sanitizer. Then, greet your patient. Hi, Mr. B. I'm Dr. Amanini. Today we'll be doing an eye exam for you. Would that be all right?
Yes.
Retrieve your tools and sterile gloves from a sterile surface. Start the eye exam by checking the patient's eyelids and look for any muscle spasms or eyelid droopings. This could possibly be a sign of ptosis, which is an early indicator of myasthenia gravis, which is a disease that causes muscle weakness throughout the whole body and usually starts with the face. Hold a pen in front of your patient and slowly move it from side to side and have your patient follow the movement with only their eyes. This checks for ophthalmoplegia or paralysis of muscles in charge of eye movement. Then, check the patient's pupil shape and size with a torchlight by gently bringing the light to the eye from each side. This will check for Horner syndrome, which is inefficient communication between the nerves of the brain and eye, usually resulting from a stroke. It will be shown if the pupils are unequal in size. Then, check for the pupil's contraction to light, or eye meiosis. If a patient has pinpoint pupils, it might be a sign of drug overdose, and a drug urine screening should be issued right away. If a pupil is fixed and dilated, this is proof of a brain-dead patient. Gently lift the patient's upper eyelid and ask them to look down in order to clearly show the sclera, or the white part of the eye. If it's a yellow color instead of a white, it is a sign of jaundice, which demonstrates liver disease or liver failure. Repeat this action with the patient's lower eyelid, but be sure not to get so close that it will cause irritation. Check the conjunctiva of the patient. It should normally be a pink color like this patient's. However, if it is white, it could be low iron and you must issue a blood test to test for potential kinds of anemia. And lastly, consult your patient. Mr. B, your eye exam went well and there are no problems, so you're good to go.
Thank you.
And after speaking to your patients, be sure to wash your hands with soap and water.